obviously not at the moment طبعا. We can fix on this image. The foreskin retraction, the foreskin is supposed to be pulled upwards, that is to say, be retracted in order to expose the glands. Our glands being exposed in this area, the glands and the coronal ridge or the coronal sulcus. The ridge, obviously, glands bulges, so in so doing, it creates a sulcus. It's the foreskin, the beginning when the foreskin is fully covering the glands, and then it's a bit retracted. There is a mucous surface and how do you call it, a skin surface in the middle line ventrally, and you can see also how the glands is shorter on the ventral surface and longer on the dorsal surface, which means that if you want to remove the foreskin, you need to remove it more or less obliquely. And if you remove it in a non-oblique fashion, then you're removing the same amount from the dorsal and the ventral, which is not the situation. There is more foreskin on the dorsum rather than the ventral, and hence you should remove more foreskin from the dorsum rather than from the ventral. Okay. If the foreskin cannot be retracted, how do you call it? Who mean by spokesman? Mean a spokesperson or spokesperson by the spokesman? Female spokesperson, Narda?
Okay, doctor, I will love to listen.
Okay, how do you call it when you cannot retract the prepuce or the foreskin? The foreskin.
We call phimosis.
So it's called phimosis. So if someone's prepuce is so tight and cannot be retracted, they suffer what you call a phimosis. This is different from. Sorry, go on.
Like this one, I'm phimosis. The first picture.
The first picture, okay. This is what we call phimosis. It is different from narrowing of the internal from the urethral orifice. It's not the same with phimosis. What happens when people micturate with phimosis? Yeah, Pradeep. What happens when they micturate?
It's, I mean, flow of the urine will be retention. There will be retention, and there will be little flow of urine outside, little, and there will be a lot of retention. I mean, stream will be very thin, urine stream.
Yeah, but the prepuce sort of balloons.
Yes, and because of retention, balloons, yes.
They'll actually micturate within the prepuce, and then the prepuce sort of swells, and it sort of balloons. So this is phimosis. Obviously, if someone's got a phimosis, at least the prepuce has to be cut, not necessarily excised. At times, people view circumcisions as mutilating operations. In women or girls, this is obviously standard. It should never be done. In men, obviously, it's debatable. From a religious point of view, it is probably done in all Islamic countries as a ritual, maybe a lot of other countries. But if people have retained their prepuce, there are indications, medical indications to excise it. لكن طبعا في ريتيول يعني طقوس وتقاليد الدين زي ما انتم اكيد عارفين. What is a paraphimosis? What is a paraphimosis, يا Pradeep?
Paraphimosis means once it gets retracted behind the glands of penis, it doesn't, I mean, go forward again. It gets retracted and constricted there. It makes a constriction ring out there.
Okay, so this is paraphimosis. A paraphimosis, not a true phimosis, a para one, where the prepuce becomes retracted and it sort of constricts and becomes constricted, and its glands becomes edematous, and the vicious circle is established, so that the more edema of the glands, the more the constriction, and the more the constriction, the more the edema, and it's a very serious situation because at the end of the day, the glands may slough. Paraphimosis needs an urgent cut, at least of the prepuce. You can try sometimes conservative management when you sort of compress the glands and give a local anesthetic and so on, topical, so that you try to get the foreskin back to its normal location. Paraphimosis, it's not seen in this country at all because men are all circumcised in the vast majority, let's say in the vast majority. Like in other countries where the rule is not to circumcise boys, the paraphimosis issue is an issue, and it's a serious problem. It's very painful. You can imagine it's very painful. Paraphimosis. Phimosis is when the narrowing of the natural orifice is normal, is as is narrowed, but a paraphimosis means that it is retracted. It does not, you cannot pull it downwards, and it causes a constriction, like Parib was telling us. How about inflammation of the glands? How do you call inflammation of the glands?
Balanitis.
And how do you call inflammation of the prepuce?
Pubic inflammation. It's, I think, balanitis.
The prepuce is posthitis. It's posthitis. Posthitis. The prepuce is posthitis. Just P and the P, and balanitis is the glands, and bananoposthitis is inflammation of both. This is a good indication for a circumcision. If someone develops a carcinoma of the prepuce or the glands, you may remove the prepuce in order to irradiate the glands, or you remove it as a curative. Like in this country, indications of circumcision are basically rituals, religious ritual. فطقوس وتقاليد الدين بتقول انه you circumcise infants, or maybe earlier. Okay, yalla, we'll get back to the Hazim. We'll get back to the diagram. We'll get back, as not to the diagram, to the handout.
دكتور صباح الخير يا دكتور نور.
ايوه نور، صباح الخير.
الرسمه اللي حضرتك قلت لي عليها
حاضر هنعملها. We just get rid of this thing. We've decided to start with the prepuce and the benign disease, and then we'll go on to the funiculitis and epididymitis and this sort of thing. We'll start with the prepuce, then we'll go on discussing the other things. Today's menu is very straightforward. We're going to discuss a few penile diseases, and we're going to discuss circs. I think that we've already prepared, Hazim has already prepared a video in order to demonstrate a circ. A circ is short for circumcision, which is removal of the foreskin or the penile, the prepuce, I mean. And then we'll go on to discuss the funiculitis and assess the diagrams that Noor has provided us and the ones that I've drew. This is what we're going to be doing tomorrow. Azi today. Tomorrow, inshallah, we'll be starting with the peds. And with the peds, we're going to start with neonatal intestinal obstruction. About peds, there is a ped gastroenterology, ped urology, ped plastic, everything. But we're going to start with the gastroenterology part. So this is what we're going to be doing tomorrow. But until tomorrow, inshallah, we're going to proceed with the prepuce and this sort of business. The adjective from prepuce is prepucial. Prepuce is foreskin, two surfaces with smegma, starts at the coronal sulcus, short on ventral surface. We've seen these things. Normally retractile, الكلام اللي وريناه ده كله. طبعا penile anatomy, there are two corpora cavernosa and the corpus spongiosum. The two corpora cavernosa are present on the dorsum and the corpus spongiosum on the ventral surface. The corpus spongiosum very proximally becomes dilated and forms the bulb, where the bulbar urethra obviously resides. The corpus spongiosum, obviously, it is the part through which the urethra travels. Now, as best نتكلم عن frenular vessels, it's like the frenulum of the tongue. I'm sure you're all aware of the fact that your tongue people's tongues are attached to the floor of the mouth. If the attachment is so tight, you call it a tongue tie, which needs management very early after birth. Otherwise, people are unable to move their tongue and they do not articulate properly. But there are also frenular vessels in the frenum, the frenum of the tongue. It's very similar to the undersurface of the glans, which is attached to the ventral surface of the prepuce by the frenum. in the middle line, and obviously there are frenular vessels. It's all about when you're performing a circumcision to manage these frenular vessels. Otherwise, you're going to be to encounter a bleed in an infant. Pradeep, do you know how much blood is there in an infant? What is the blood volume of an infant? That is 5 kilograms.
It's 80 ml, I think 80 ml per kg.
80 mil per kg, so it's nothing at all. So if someone is 3 kilograms, they have got only something like, I don't know, 250 or 200 mils of blood, something like it's 80 for each kilogram. Maybe in adults it's 70. Remember that this 5-liter volume of blood is not standard. It all relates to the body weight, and it's something in the adult is 70 times. It is 70 times the body weight, and it's in children it's 80 times the body weight. If I remember that if an infant who's 5 or 7 kilograms loses 100 mils of blood, they've lost the vast majority of the blood. Yalla, Azim, Hazem, we want to proceed with the handout. Apart from the circ, we've been talking about phimosis, osteitis, paraphimosis, balanitis. We've been talking about these things. Phimosis is when the orifice of the prepuce is narrowing, and it's not narrowing of the urethral orifice. And the paraphimosis, when you retract the prepuce and it does not go downwards again, it's an emergency. Paraphimosis, meatal stenosis, hypospadias, epispadias. What is epispadias and hypospadias, Pradeep? What are they?
Epispadias means the opening of urethral meatus is above, or it may be on the shaft, on the root, and hypospadias means the opening of urethral opening is below surface of the penis. Either it may be at corona, it may be in the shaft, or at the root.
Okay, that's two things I'd like to mention. The adjective of penile is better than a penis. Yani better than repeating the word penis. You'd just call it the penile shaft. Okay, and then you'd rather call it the ventral and dorsal surface. You'd rather call it ventral, but above and below are the same. Against the ventral and dorsal surface, which is commoner?
Ventral hypospadias.
It's far commoner. What about its incidence? What is the incidence of hypospadias?
Hypo, I think, Maslan, I guess 1 in 1,000 maybe.
No, it's much more. It's 1 in 300 actually. So it's a very common problem. It's 1 in 300. It's a common problem. And hypospadias, people specialize in treating hypospadias. It needs a lot of skill in order to avoid fistulation of the neo-urethra. Hypospadias and epispadias. Cordy. What is cordy? What is a cordy?
Cordae is, the lower ventral surface frenulum is attached tightly to the, glans penis. I don't know. I'm not sure about this.
A cordy is a penile deformity. A cordy is a penile deformity. It is very similar to a cord, a fibrous cord, but it is not a fibrous cord. It is a deformity of the penile shaft. So that with erection, the penile shaft sort of becomes curved. It may be curved dorsally, ventrally to one side, and it's at times a normal thing where the two corpora are not of normal size, but it also develops it is also present in hypospadias. It's very, very important to acknowledge this, or to appreciate this, that the abnormal urethra is replaced by fibrous cord. The urethra that is not formed is replaced by fibrous cord, and this fibrous cord that causes the ventral cordy. So cordy is penile deformity. Penile, when the penile shaft is curved to the upwards, downwards, or to one side. Okay, it's not the fibrous cord. The cordy is a deformity that is caused by fibrous cord, possibly, or at times by the inequality of the size of the corpus on both sides. The corpora at times unequal, so that if they're shorter on one side, normally as a variant, obviously penile shaft will deviate towards this side. Remember that penile and anal are better than penis and anus. If you want to talk about the anus, you talk about it in the form of an anal canal. And if you want to talk about the penile shaft, it will be better than mentioning penis. Peyronie's disease. What is Peyronie's disease?
Peyronie's, sorry, doctor, I don't have idea about this.
When the corpora become fibrosed, when the corpora become fibrosed, usually in older men, and then again there will be, it's a form of fibromatosis, and again there will be a penile deformity. A penile deformity is called the cordie. So obviously the corpora will not allow a proper erection. Then the penile shaft may be deviated to one side, or at times it has got a ventral or dorsal curvature. And what is prepism?
It's a sustained erection of penile shaft.
Just a sustained erection? Is this just this definition, or has it got two other prerequisites?
More than 4 hours, I guess.
Maybe more than 4 hours. I'm not so sure about the timing, but something very important about it. What is important about the prepism, other than that it is a sustained erection?
It's painful, I guess. Someone
painful. Yes, it's painful, and it's aimless.
Okay.
It's aimless and it's painful and it's sustained. If you read about the 4-hour period, or are you suggesting it?
I have read somewhere. It's 4 hours, I guess. But
it's sustained. I'm not sure very much. I did not come across this duration in particular, but if you read it, it's okay. But it's sustained, it is aimless, and it's painful. And what is the fracture? What is the penile fracture?
It's usually during erection time, shaft may get fractured during sexual intercourse, or maybe by traumatic injuries.
Yes, it can be injured, whatever it is. If the corpora become injured during their erectile phase, obviously it's called a fracture because they're similar to a bone. Okay, a fracture. Balanitis. What is balanitis?
Balanitis is inflammation of the gland.
Of the glands, yes. And what is posthitis? What is posthitis?
It's an inflammation of peripube.
Of the what? Sorry.
Prepube skin.
Of the prepuce, of the preputial skin or the foreskin. So this is balanitis. This is posthitis, and the balanopostitis are the combination, obviously. Calculi, sometimes desiccated and dried smegma forms calculi. Not a true calculus, but anything that becomes sort of really desiccated and dried may be called the calculus. For sometimes you get these preputial calculi simply because of dried or desiccated smegma. Okay. Obviously we want to move upwards. طب في عندنا أي حاجة تانية. If you're going to perform a penile examination, you obviously examine the penile shaft from the ventral and the dorsal surfaces, the urethra. If there is a prepuce, you have to retract it. If there's no prepuce, you examine the glands and the how do you call it, the glandular ridge and the coronal sulcus. بس ما عندناش حاجة تانية. I don't think we've got anything to add. يبقى عاوزين نتكلم على remember the discharge. Where do you look for the discharge, Pradeep?
Discharge.
Urethral discharge indicating urethritis. Yes. Where do you look for it?
Underwears or its ventral surface.
Underwear. Yeah. Underwear. Underclothing. Underclothing again would be a better word. Underclothing. Euphemism. I don't know. Abdullah was referring to euphemism. Euphemism is EU. I'm sure you all know that EU is something good or something normal or something better. Euphemism. At times you use words, obviously, that imply the same meaning at the end, but they are less sort of just like when you say someone is passed away instead of died, and someone is, I don't know, hard of seeing instead of I don't know what.
Yes.
Okay, فيلا how about بقى the steps of a circumcision. حازم عندنا الفيديو.
يا فندم موجودين حاضر.
طب يلا. طبعا circs are very commonly performed. You can see one in the clinic. Circs in this hospital obviously are very rarely done in the OR. They're done in the clinic in a way that I do not like, but this is how they are. Circs can be done in different ways. Circs, short for circumcision. حازم هيحط لنا فيديو كده هنشوفه دلوقتي عامل ازاي.
دكتور هو حضرتك قلت لي في جومكو وفي بلاستيبيل وفي بون
كاتنج.
حضرتك تحب انهي واحد يعني نبدا بايه؟
خلينا نحط البون كاتنج. فحازم هو is already aware that there are a few devices and maybe more. The GOMCO, the one that we mentioned yesterday, طبعا Co is company, وGOM is the name of the company that devised this special clamp for performing a circumcision. طبعا you can use a bone cutting forceps, you can use dissection, just cut the thing by dissection. طبعا it's important to provide men with a good cosmetic result because at times there's a lot of scarring. A cosmetic result is of importance. يلا نشوف البون كاتنج. نشوف البون كاتنج بيعملوه ازاي ده. لو ممكن يا حازم.
Recently, there is also a stapler technique, right, doctor?
Maybe, yes. There's so many devices that you can use, yes.
Okay.
You can see that they've already retracted the penile, the prepuce. If they're using they have not used the bone cutting forceps in this situation. They've just sort of marked the level and they're cutting it. Okay, they're cutting it to the level of the coronal sulcus. They remove more on the dorsal rather than on the ventral surface. Obviously, you have to be careful while you're they're putting a mark at the level where they want to cut. They're putting a mark, whatever this mark may be. Oh, they're putting a forceps. Oh, this is an artery forceps. It can be a bone cutting forceps. Oh, they're putting it. It has to be put more oblique. How's it oblique? So that you're removing more on the dorsal and less on the ventral, because this is a bit oblique, I think. And then they're simply going to get a scalpel and cut that. Oh, they'll continue cut. طبعا then they're continuing with a bit of the scissors. There's so many types of methods of doing it. Oh, and then you may suture both edges together. طبعا the under surface is the mucous membrane, the over surface is the frenular vessels in particular. The frenular vessels are home. The frenular vessels are the ones that you worry about most, because you don't want people bleeding and parents becoming worked out and worked up, and you becoming the target of I don't know what. You can suture all around, or you can suture the frenular vessels. You don't want to bleed. Obviously, while you're cutting, you can injure the gland, you can injure the urethra, you can perform excessive removal of the skin, or you can remove less than you expect to remove. They're doing the stitching all around. You can see that there is a mucus layer part and the skin part. a cosmetic result is required because you don't want the area scarred for no good reason. If there's a good reason, then there may be and then you end up with this appearance. You have to make sure that your people are not bleeding. And if you're going to use diathermy, what about if you're going to use diathermy? Hey, Hazem. Hey, Hazem, what about if you're going to use diathermy? Pradeep.
Yes, doctor.
If you use diathermy, anything about using diathermy with a penile shaft?
Maybe penile shaft is very soft tissue that, may get injured or.
So what about using diathermy? Do you think you'll use diathermy? Do you think you'll not use it? Or if you're going to use it, are you going to use a special type of diathermy?
Yes, maybe normal diathermy cannot be used because it's very soft area, and also blood vessels may, get much for recovery. For recovery, it will be dead scar tissue that will be hard to heal. So I think we should not use diathermy.
Okay, you may use diathermy, but it's a special type. It's the bipolar. You shouldn't use, just like you've said, you shouldn't be using ordinary diathermy. You should use bipolar diathermy. The risk of monopolar, a bipolar diathermy is when your forceps, the forceps that you hold, carries the two poles between which the current will travel. So it's got a very limited effect on the tissues in between the blades. But with the monopolar, the current will travel in the body in order to get out of the body through a blade that is put far away. But there's a risk of going through the penile arteries and causing a sloughing of the penile shaft. Whenever you're dealing with the end arteries, or whenever you're close to very important structures, like in neurosurgery, like in the parotid, like in the penile, like in the digits, in penile surgery, you use bipolar. Bipolar diathermy. Bipolar diathermy comes in two types. There's a monopolar type and a bipolar type. With the monopolar type, obviously with the diathermy, there are two poles. The electric current enters the body through a pole and it gets out of the body through another pole. If the forceps that you're holding is actually composed, the two blades are the two poles, so the electric current just travels between the two poles. The two poles are usually holding the tissues in between. They travel for a very short distance in between two poles. But the monopolar, they've got a blade that you carry, that you use, and another blade that is stuck to the body, that is really wide and stuck to the body somewhere else. In order for the current to get out of the body, it has to travel wherever it wishes. And that is why when someone will have a diathermy used, they have to be not in contact with any sort of conductor. Otherwise, the electric current will travel inside the body and will get out of the side of the conductor, causing a burn at that site. All metal should be isolated, insulated from, obviously, not to be in contact with the body. عندنا two types of diathermy. طبعا ده مش موضوعنا النهارده, because there are two types of diathermy and it's important to remember them. The two types, the monopolar and the bipolar. Monopolar and bipolar. Well, bipolar means that you're carrying in your hand, the forces you're carrying is composed of the two different.
Hello. Guys, you can hear? I cannot hear.
No, we can hear you.
His pose, probably there's a call or something. guys معلش النت بس يعني فصل. هو why don't we use the diathermy تاني في circumcision?
Usually, as doctor said, I guess, is trying to impose that maybe in monopolar that it may injure the soft tissue around, especially the shaft area, but in bipolar that is not that much traumatic. I also don't have the clear I will see for that. I didn't get the clear.
It's about the soft tissues. It's not about soft tissues. It's about important tissues. Bipolar diathermy does not allow the electric current to travel except between the two poles, which are very close to one another. With monopolar, the electric current gets inside the body at one point that you're diathermizing and travels whichever direction it wants in order to get out of the other pole. The other pole is stuck usually to the sacrum, to the gluteal region, and it's a wide area, so that it travels, so that it can travel in whichever direction, whichever tissue it wants. That is why if you've got a very important structure close to you and you use monopolar, you cannot guarantee the direction of the current, whether it travels through an artery, a nerve, whatever it is. But if you're using bipolar, the electric current will not travel except between the two poles that form actually your forceps. So when you get hold of something to diathermize it, the current just travels between the two poles. With the monopolar, it travels inside the body through your forceps, and it goes all around the body to get out of a wider pole, so that if it's wide, so that the area of contact between the body and the pole is really wide, it will not cause a burn. If it's not properly stuck to the body, then it causes a burn at the site of exit. Okay, so if you're performing parotid surgery, for example, and you're worried about, in the parotid surgery, what are you worried about, your Pradeep? Pradeep, what are you worried about if you're performing parotid surgery?
In parotid surgery, we are very concerned about the facial nerves and its 5 branches. And
it's a facial nerve. If you're performing parotid surgery and you're using diathermy, you should not use monopolar, because monopolar diathermy may decide by mere chance, but at random, to travel through the facial nerve. And if it does that, then the facial nerve becomes obviously destroyed. The same with the thyroid. Ulia Pradeep, go on.
I have seen in operation room before, doctor used to, press something by foot, and while using that, I think diathermy, it's mono or bi, I don't know about that, but they used to press with the foot, and they touch that skin or vessels, and other doctor stitch another, lead or something like that, and again that get sutured or blocked. I don't know, it's monopolar, bipolar.
Monopolar and bipolar is just settings. There's just settings on the set. There's just settings on the machine. Yes, people tend to, surgeons tend to use a foot control in order to activate the diathermy machine or deactivate it, instead of having its control with someone else, because then they're never sure when and when not to use the diathermy. In this hospital, at times, the nurse is in control of the foot control, but then it's not very safe. It's safest that the surgeon is able to coordinate when they want to use the diathermy and have their foot control, so that they press the foot control and then the diathermy becomes activated. Okay? It's the same machine with different settings. You can set it on a bipolar setting, on a monopolar setting. It's not an issue. Or you can set it on any other issue you want. Okay? Remember that if you're operating upon a digit, the digit has got obviously end arteries, the digital arteries, and if you use monopolar diathermy, then it is very serious, because the monopolar, the current, in order to get outside of the body, will travel inside the digit and the rest of the body until it reaches its outlet. In doing so, it may choose to travel through the digital artery at random. It travels at random. It travels in areas of least resistance. And so doing, it can injure the end artery that the blood supply is based on.
That may lead to ischemia.
Because the neurosurgery cannot afford the current diffusing in the brain and injuring so many areas in the brain. So you need to use bipolar as a rule. Okay.
دكتور
قول مين اللي بيتكلم دلوقتي، عبد الله ولا مين؟
لا اسلام يا دكتور.
قول يا اسلام.
طب يا دكتور كده البايبولر احسن، انا ليه بستخدم المونوبولر اصلا في اي
Because
حاجه؟
it's much weaker. Bipolar is much weaker. This is the answer. It's just much weaker. It's effect because the current just travels between the two ends, and it's much weaker. This is the answer.
شكرا دكتور.
طيب يبقى هنرجع I hope that you've got an idea of how to perform a circumcision. Remember, this is one of the operations that you need to know how to perform. you see a lot, and then you assist. طبعا assisting in the circumcision is something just like seeing, and then you have to perform under supervision. Then you have to perform with the supervisor around somewhere, and then you have to perform on your own, and then you have to train. Yeah, there are stages. You see something, and then you do it with someone scrubbed, and then you do it with someone unscrubbed, and then you do it with someone not around, but I mean a good distance away, and then you do it on your own, and then you train someone else. These are the steps of passing through a training for a certain operation. You've seen how. Sorry. What type of anesthesia do these infants receive? Do they do it without an anesthetic?
Local anesthesia will be good.
What type of local anesthesia?
Maybe it's lidocaine, I think.
Where will you give this local anesthetic?
At the penile root.
Maybe penile root.
Pudendal nerve, I guess.
Sorry.
It's given inside pudendal nerve or what? And
no, you don't give it inside the pudendal nerve. You just give it. It's infiltration. You don't target a nerve in particular. You just give it in the around the penile root, so it anesthetizes all nerves in the area. It's not a particular nerve block. It's just it's a subcutaneous infiltration. You just give it to the penile root. What about this xylocaine that you're talking about? What about xylocaine that you're talking about? What about the dose?
It's dose. I don't know. I don't know, doctor.
It's called the figure 3 in relation to xylocaine, lidocaine, lignocaine. Very important to remember. You use it a lot. People, the medical practitioners tend to use it a lot. It's xylocaine, lidocaine, or lignocaine, and it's 3%. It's 2%. Well, yes, it is 2%, but then there's the rule of 2 trees. You give 3 mils per kilogram, 3 milligrams per kilogram, and it's you wait for 3 minutes, and you give 3 mils for each 1 centimeter of incision if you're going to incise. See the rule of threes. Xylocaine or lidocaine, lignocaine, they're the same. It's a well-known antiarrhythmic. I'm sure you all know, an anticonvulsant, but it's also used as a local anesthetic. Lignocaine, lidocaine, xylocaine are synonyms. Okay, they're synonyms. They're all the same, and it comes in 2%. You can dilute it to 1% by equal amounts of saline. But then there's the rule of threes, that you give 3 milligrams per kilogram, 3 milligrams per kilogram, and you wait for 3 minutes. Once you've given it, you do not rush to operate because it won't act sort of instantaneously. And you give, if you're cutting, if you're performing an incision, then you give 3 mils. You give 3 mils of xylocaine. The solution for each 1 centimeter. The rule of threes.
Okay, means the rule of threes is 3 ml prati kg, and we wait for 3 minutes, right?
And 3 milli for each 1 centimeter incision?
Oh. For each centimeter, you mean?
Someone's trying to call me, but they didn't answer, and they did not put the phone off. I'm with you at the moment. خلاص, this is something else that you use is EMLA. EMLA cream, where you put that cream on the area that you're going to incise or you're going to puncture. The EMLA cream. EMLA is an acronym for eutactic mixture of local anesthesia. Eutactic mixture of local anesthesia, EMLA. Eutactic mixture of local EMLA cream. You can also use that. In this hospital, unfortunately, it's done under no anesthetic, which is very traumatic to these, not in children, obviously, in infants, I mean. لكن طبعا it's still very traumatic, and you have seen the steps. نشوفها مرة تانية. ممكن نشوفها مرة تانية حازم من فضلك؟
يا دكتور، نفس الفيديو. Doctor,
I think doctor may have received call, I guess. Someone was saying about the rule of three. Can you repeat it, please? I mean, just I got that 3 ml prati kg, and we wait for.
it's 2%. It's 3 milli for each kilogram, and waits for 3 minutes. And if you are doing an incision, it's 3 milli for each 1 centimeter incision.
Okay, thank you, Hazim.
You're welcome.
Hazim,
Yes.
Hazim, till doctors arrives, can you play that video once about the circumcision? The video you played last.
Yes, sure.
Tamam. Thank you, Hazim. Hello guys, till doctors arrive, I was willing to show you my PPT. Is it okay? No one is here, but okay. Okay. We saw up to here. I mean, this is the technique of retraction, natural retraction, and these are few indications. And also, doctor mentioned the another indication. I mean, religious, cultural one. And then we have technique of circumcisions. There are a lot technique, but these are most famous one. And the most advanced and recent one, which I have find on internet, is this stapler technique. We have cross excision, which is also known as bone cutting. Here, baby is placed on circumstant board. Then, as doctor explained now, we give anesthesia local, and then we separate the foreskin and proceed as usual, as in saw us in the video, same like that. And we have, this is the cross excision. This is Gomko clamp technique. Actually, these are this one is a special instrument. It has a head, I mean bulb, that is inserted inside, and once it's inserted, it is then doctor start to fix this clamp, I mean another instrument, and they cut it from outside. And this is the plast bale procedure. This is also similar. The only difference between Gomco clamp and plast bale is it's more hemostatic. Here we can see this at the third picture on the right side. There is a plastic bale that is usually used to stop the bleeding. It is more hemostatic than previous Gomco clamp technique. And then this is dissection excision, usually used in adult. Usually this is used for adult. And the last one, the most recent one, is the stapler technique. Here the idea is, I mean, doctor used to measure the size of the most distended part of glans penis, as you saw in the picture number 1, and they give local anesthesia, and they put the bale inside, and simply this is the stapler. This number 4, this is the stapler. Simply insert. It has, I mean, it cut and also suture at the same time. It has circular stapler, and just within a second, this is firing. He is firing. Doctor is firing, and simply it will cut that person, and it is removed. You can see in the picture 8, and in picture 9, you can see the prepuke foreskin is removed on the bell. It's very advanced and latest technique.
Sorry to interrupt, Pradeep.
Okay.
But the doctor has a problem with the mic.
خلاص انا معاك وخلاص كده خرجت وطلعت فانا معاك خلاص. I'm back to the thing. فدلوقتي انتوا شفتوا الجومكو كلامب ولا in that section? Did you see the method of the bone cutting or the artery forceps or whatever? Did you see it again?
دكتور هو بس كنا بنتكلم على الانستيزيا وانا كان عندي سؤال بعد اذن حضرتك.
طبعا قول يا حبيبي.
هو حضرتك قلت ان احنا بندي 3 مللي لكل 1 سنتيمتر انسجن. طب دي اوكي مفهومه، بس يعني ايه 3 مللي لكل كيلو جرام ماكسيمم؟ يعني
3 جرامز، هو 3 ملز غير 3 ملي جرامز. 3 ملي جرامز يعني the dose is 3 milligrams per kilogram. لكن 3 mils the solution. How many, what amount do you give for each incision, centimeter incision?
تمام.
يعني دلوقتي the concentration of lidocaine or xalocaine is 2%. 2% means that there are 2 grams in every 100 mils. There are 2 grams. يعني 2000 milligrams. In 100 mils, there are 2000 milligrams. You can only give 3 milligrams per kilogram. If they're only 3 kilograms weight or 5 kilograms, then you're going to give them only 15. في الادلت بتدي اكتر بكتير. في الادلت بتحسب 3 على 70 يبقى 200. يبقى this is the dose that you give. In how many mils بقى it's completely different. يعني is it clear يا حازم ولا ايه؟
يا فندم كده كلير تمام.
اوكي يعني the rule of threes xalocaine, lidocaine او lignocaine, they're all synonyms. They're synonyms. There are so many other local anesthetics. Maybe the other most famous one is bupivacaine. Bupivacaine. Xalocaine has got a rapid onset and a short duration. يعني it acts quickly, but it acts for a short while. Bupivacaine is the reverse. It acts after a longer time, but it keeps acting for a few hours. ده الفرق الأساسي بينهم. Bupivacaine. Or bupivacaine is the one that is used for spinal and for epidural, and we'll discuss anesthesia once we'll get done with the peds. Once we'll get done with the peds, we're going to be discussing anesthesia. Like at the moment, suffice يعني it is sufficient to know that it is 2%. You can dilute it to 1%, and you give 3 milligrams or من 3 to 7 as a standard 5. بس عشان نخليها الرول بتاعت التريز تبقى 3 milligrams per kilogram. If you give someone an overdose, you're risking a very serious, potentially fatal side effect. People convulse, people develop an arrhythmia, people have their respiratory and their cardiovascular systems in the medulla inhibited. It's very serious, and people have succumbed because of being given local anesthetics without the medical practitioner being ready to resusc. Local anesthetics are given in dentistry clinics as an ordinary thing, which is very, very serious. In fact, يعني بياخدوا risks. These people take risks. Like that is how it is. It shouldn't be that way. It's 3 milligrams per kilogram. You wait for 3 minutes, and you give 3 mils of as in volume per centimeter of incision. عشان you don't want, if you give a local anesthetic, people should be pain free. Some of these infants are different, because obviously if you try to keep them still and get hold of their limbs and so on, they'll cry anyways, but at least they'll not have pain. Like if you're operating upon an adult, they should be pain free, and you should in fact operate only when you test. You prick the area and you verify that they're already pain free. هنرجع بقى تاني لحكايه because there's so many devices وطبعا you don't need to know all the devices because first of all you need to be familiar with the device that is available in the institute or the one that you're happy using. As long as it's available, you cannot be happy using something that is not available طبعا. وبعدين الحاجه الثانيه for exam purposes may be different because for exam purposes you may need to know much more than what you use for practice. But in practice you may be happy with one as long as you're familiar with it and as long as the results are okay. And it has to be available. If it's not available, then you can't say, hey, I only use this one. If you use certain device and it's not available, if you've changed jobs or something, then you have to be familiar with the new one. Okay. يبقى هنشوف بقى دلوقتي يلا let's see الsteps اللي شفناها that people retract the prepuce and they're sure it's retracted and then they pull on the prepuce using mosquito forceps or small RT forceps and then they mark the level of the glands and then they apply whatever forceps they're going to apply. The bone cutting forceps is obviously not basically used for circumcisions and you push the glands upwards. You don't want to injure it and you don't want to apply forceps to the glands, otherwise it's a very ugly injury. The glands is a very peculiar structure with the skin that is adherent and it is not repairable in a sense. يعني it becomes really scarred and then you make sure that the glands is mobile, then you sort of shave the skin of your forceps, whatever forceps. And they're probably cutting only one layer. They're probably cutting only one layer of the thing. They're cutting only one layer. You can cut only one layer at a time. You can very well do that. في 2 layers, and you have to leave mucosal layer because it's more sensitive, and obviously sensitivity in this area is important. They leave on the under surface more mucous membrane. Mucous membrane is more sensitive than the skin, obviously. Oh, they've applied the bone cutting forceps. You have to apply it. This is not a bone cutting forceps. This is an ordinary forceps. Where you have to apply it obliquely, not straight. In fact, I would have cut from the opposite side. I wouldn't have cut from the penile side. I would cut from the outer side, so that I make sure that I do not injure the glands more and more. Okay. Oh, he's cut already. The glands is there. He's removing more and more skin. Oh, طبعا this makes the scar not very neat. A neat scar is important in the area again. وبعدين there is going to suture the edges together. You may not, if you're using a bone cutting forceps and you keep crushing the skin for a while, you may not need that step. وطبعا the frenular vessels are the ones that are very prone to bleed. The frenular, because of the skin all around will bleed from the skin itself, but the frenular vessels will bleed from the frenular vessels, which may be a problem. Pradeep, can you enumerate the complications of a circ?
Yes, complication maybe is excess removal of skin.
Yeah, you remove more skin and then the shaft becomes embedded. It becomes retracted and embedded in the pubic area. Yes, you remove more skin than expected. Yes, the thing becomes scarred and the penile shaft becomes sort of embedded in the suprapubic area. This is one. Yes, what other thing?
And maybe less excision. I mean, not the one less than expected. I mean, exactly.
Then you remove much less than you wanted to, and then you need a recirc.
Yes.
Remove too little or too much. This is always a complication of any surgery. Remove too little or too much. Yes. What else? What injuries can you incur on someone?
Bleeding can also occur if
طبعا we're talking about bleeding. Bleeding is the major complication. What will increase the bleeding? What will increase the bleeding if the man or the woman, as the baby is what?
if
the baby is
if
what?
if he is male, then hemophilia will affect this baby.
See, at times, oh, this is the bone cutting forceps. Oh, this is the bone cutting. This is a correct bone cutting forceps. Oh, and they'll cut it from the outer side, just like I was telling you, all in one go. All in one go. They shave it. They shave the prepucial skin. That one you don't want to injure the people's thighs and I don't know what with your knife. Remember, because your knife maybe you may act in an erratic way so that you injure the thighs. That one very bad thing to happen. وخلاص you keep crushing the area, so that you don't need to take any stitches, and then you apply a very gentle, you crushed it and that's it. You keep crushing it for a while so that the vessels become actually crushed. وخلاص, and that's just less and left like that. It carries the risk. كله carries the risk. The fact that something carries the risk doesn't mean that you're not هنا تاخد stitches. You may or may not, but obviously not taking them carries more of a risk. هو is actually already bleeding. Coagulopathy, remember that this may be a presentation of hemophilia, that this boy bled during the circumcision. One very typical thing that happens. You dress them circumferentially, you put something that is not adherent. At times, the area becomes crusted and scabbed, and people suffer severe pain, and they may go even into retention. What other injuries can, other than the glands? What other thing can what other thing can be injured other than the glands?
Maybe meatal shaft and meatal opening. If the meatal opening is
the urethra. The urethra is very close at this point. The urethra is very close. So when you're suturing the frenulal vessels, you may very injure in the urethra. If the urethra is injured, what happens? Or if it's injured, what will happen? Yeah, Pradeep?
There will be bleeding permeatus. I mean, that bleed may go inside and may come outside. It has two way.
Okay, but what will happen later on if you've injured the urethra? It will bleed
it will lead to stricture, I mean, in a long run, and that can lead to retention of urine.
Actually, you've actually cut the urethra. You've actually cut it. But what will happen? What will happen when the baby micturates? Where will the urine get out of the urethra?
It will come above. I mean, if it is cutting is from above, then it will come above. I mean, urine.
What do you mean by above? Where above? Where above? What do you mean by above?
Misbedious.
سوري مين اللي قال حاجه دلوقتي؟ مين عبد الله قلت ايه ولا مين اللي قال؟
عاطف epispadias.
Epispadias هو اللي بيحصل hypospadias because the urethra. This is an important factor. Remember, the urethra is on the undersurface. You can't injure it from above. If you cannot injure it from above by any means. You cannot. You injure it from the undersurface. يعني فعشان كده كنت بقول له from above. It's a form of the acquired hypospadias because then urine will fistulate through this opening in the urethra from a point more proximal to the natural urethral orifice. Okay, it's a sort of acquired hypospadias. If you revise the penile structure, there are two corpora cavernosa that are full of cavernous tissue that is responsible, obviously, for the process of erection, and they are present dorsally. But it's the corpus spongiosum that is not erectile anymore, that is present ventrally, where it gives residence, or it contains the urethra. Where the more distal, the more superficial the urethra. At the tip of the glands, or the tip of the penile shaft, or close to its end, the urethra becomes really superficial. It is this point that may be injured, and it may be injured during particularly ligating or managing the frenulal vessels, just like we've been talking. Okay.
Okay.
دكتور لو حصل انجري طيب لليوريثرا هنعرفها ازاي؟
غالبا مش هتعرفها الا post operative when the baby starts passing urine. If you've already طبعا closed it هيجي له retention. If not, then they'll start passing urine through this new orifice. Okay, for some lesions detected during the procedure, the detected post. طب نشوف بقى الجومكو the جومكو clamp. نشوف the جومكو clamp. Oh, the GOMCO clamp is a device that is specifically retracting the penile shaft and observing the sulcus, the glandular ridge in the sulcus, the coronal sulcus. You can see the mucous membrane side, the red part of mucous glands, the inner skin اللي هو mucous membrane والcoronal sulcus. Oh. This is the method that is also used in dissection. If you want to remove it by dissection, you can do the same thing, but this is the method that is used, that is the GOMCO. Okay, the GOMCO forceps or the GOMCO clamp, I mean.
طب يا دكتور، هو السايز اللي بنقطعه ده بنحدده على اساس ايه؟
الايه؟
السايز بتاع السكين.
السايز بتاع السكين هو بتحدده انه from the tip of the skin all the way to the coronal sulcus. يعني the end of the glands, because this is supposed to start before the glands. It starts just proximal on the penile shaft, just proximal to the ridge and the sulcus. فده بتحدده هنا you're protecting the glands by the thing that is put there, and you're marking the site of the coronal sulcus from above, from outwards يعني, and then you're this is how the GOMCO will look like at the end of its application. It's all about a neat scar. It's all about a neat scar. When there is no risk of injuring the glands because the glands is already protected. The neatness of the scar is important. I think it's very, very important. It's of secondary issue, but secondary issues are at times very, very important. you'll not use the GOMCO unless you've got the GOMCO, فyou cannot insist on using the GOMCO unless it's there, obviously. دي كانت محطوطة على الجلانز، مش ممكن هتعورها، وابتدت بدورسال سليت. Nice looking scar. الكولر اللي جوانيه inner color دي اللي بقول لك عليها اللي هي الميكوزا. The mucosa is important. You need to, if you have these things that is checked, because you don't, if you remove more skin, then these angles, the one above and the one below, will not be relaxed. الميوكس membrane اهو بيستعمل diathermy، لازم يستعمل diathermy تكون mono bipolar يبقى bipolar طبعا. اهو a very neat way of doing it. If you haven't got the device, you can do it by dissection where you start. يلا عاوزين نشوفها مرة تانية، أشوفها مرة تانية مش عشان أنا بحب أعيد الحاجات بس because you need to have seen it a lot. The dorsal slit, the beginning, he started with the dorsal slit. If you remember how he applied in the middle line, he's marked out. He's marked the level where he wants to cut. And there are two layers on the mucosa and the skin, mucosa inner skin. So what? يعني Tamer Ashraf has done it beautifully. He's done a great demonstration of it. Local anesthesia on maybe the penile route, maybe no anesthesia at all if there's very young, which I protest against. Okay, you don't want to inject the anesthetic obviously inside the vein. If you inject local anesthesia inside the vein, you're killing people. You have to make sure that it is not inside the vein, that it is subcutaneous. You have to aspirate before, you have to inject gently. One day we'll talk about, very soon we'll talk about local anesthesia in more detail. So احنا قلنا عليها كلام كتير already. Make sure that you retract until you see the coronal sulcus. You have to see the coronal sulcus properly. Yes, you clear the smegma. You clear the smegma because you don't want the smegma interfering with any steps of your, well, you can see the mucous membrane now. The red part that is this is the or inner skin, اللي هو عمل inner skin. Okay, he's made a lovely demonstration of it الحقيقة. بعدين هو هيتخلوا بالكم هيعمل crushed skin. So you don't crush skin unless you're going to get rid of it. It's crushing the skin so that it doesn't bleed. You don't want it to bleed because you don't want it to bleed. It's just a nuisance that it bleeds. Then you're going to cut it, and you've got hold of the two the ends of the prepuce by the. Oh, this is being put on the glands, and it's pushed all the way to the coronal sulcus. And then we're pulling this thing through the skin as you through the rest of the clamp. There are sizes. Obviously, there are different sizes. You can imagine that GOMCO clamps come in different sizes. They do not come in one size because obviously different ages and different penile sizes and this sort of thing. This is the GOMCO. The GOMCO gets rid of the whole thing in one step. Hemostasis is an issue. Frenular vessels are an issue.
Doctor, while compressing with the machine, GOMCO clamp, that may compress whole penis. How to know that the compression is enough, fair enough?
It's the proper size. It's the proper size. You never compress. It is nothing to worry about.
Okay.
It's all about the size because you won't be using something that is. You don't exert more compression than the size. It fits. Let's say the penile shaft, the diameter. Okay. You have to choose one of good size and proper size. You're pulling on that, and then you're going to cut it like you've just seen. I hope that you got a good idea of how to perform a circumcision. If you want to perform one, you should be supervised first. Okay, or you'd better see one, a real life one. طبعا seeing one that is a structured one like this one is a good step, a good initial step. اتفقنا the fact that you know something, that the fact that you've seen something, the fact you've done or haven't done يعني in other situations that you've actually experienced it. دايما there are three levels of believing يعني, that you know ولا that you've seen ولا that you've already passed through the experience. It seems funny at this location يعني. خلاص يبقى this is how you perform it.
Doctor, this is performed in outpatient clinic, right? Not in department.
I mean, outpatients, but with sterility situations, and yeah, I mean, you may call that ambulatory surgery, but not. I mean, you shouldn't be performing operations in an ordinary room. It has to be at least a clean area, and you have to take care of all the antiseptic precautions and so forth.
Like in our college, it is I mean done in outpatient clinic. I guess I have never seen in department.
Correct, طبعا. It's incorrect. It's not correct. Who said that everything is being done around you? You notice by the penoscrotal angle, the penopubic angle, so that they're relaxed. Then, if they're not there, then you've already pulled. If the penile shaft is being pulled in there, then you've removed more. Oh, this is a problem. It will need grafting later on. As you can imagine, it's a problem. Okay, the simpler the procedure, the worse the complication.
دكتور
قولي يا نور.
دكتور هو رفع في قبل ما يقص السكين، رفع ليه الانر سكين كمان؟ هو بيقطع inner واوتر سكين؟
هو بتاع both layers.
هو مش الانر لاير ده، احنا الانر سكين قلنا ده ميوكس ممبرين برضو، ده لازم يتقطع؟
ما هو البريبيوس has got two layers. The prepuce has got two layers, so you have to cut it. If you remove the skin only, you still got the prepuce covered by mucous membrane layer with a raw area on the outside. Okay. The idea is to remove both layers and end up with two edges, the skin edge and the mucous membrane edge, and you have to remove much less of the mucous membrane. You want more mucous membrane because it's more sensitive. Okay.
Okay.
بصي اهي شايفه هنا فين؟ لا كان في صوره قبل كده اهو شايفه. لا ده لا الصوره اللي قبل كده كمان، الصوره اللي قبل كده اهو شايفه اهو outer skin. If you remove the outer skin alone, you can remove them at two stages, same sitting يعني, but two stages. You remove the outer skin first and then you cut the outer skin and then you reach the mucosa. بالبتر كول ميوكوزا طبعا inner skin يعني، ما هو مش هنقعد نعمل منها ايشو يعني. اوكي نور اوكي ولا ايه؟
يا دكتور تمام. Thank you.
طيب I hope that things are as clear as could be يعني. طبعا there are no limits. The limit is the sky, where the sky is no limit, but you can go on trying to perfect things, but remember that perfecting things is not only vertical process, is also a horizontal one. If you've got 100 things to do and you're perfecting only one, then you haven't been perfect at all, because there's so many others waiting for us to complete. يبقى بعد كده عاوزين نشوف بقى الطريقة بتاعت the placebo. We're getting to the end. We've done this sort of ايه اسمها اللي عملناها دي andrology بتاع I think. Okay, we've been through the thyroid, through the breast, through the endocrinal surgery, through the hernia, through the scrotum, through the nerves that we repeat. We repeat the nerves. مش عاوزين طبعا if you want to photograph a procedure you have to consent people. Remember that. It's their own body, they're free with their own body. Between them طبعا the creator ربنا طبعا سبحانه وتعالى. بس to other people you have to consent people, even if you're going to photograph them while they're asleep or whatever. ده هيعمل بلاسيبال ولا هيعمل ايه دلوقتي تاني؟
بلاسيبال يا دكتور.
Okay. If you're going to perform dissection, you simply go through a dorsal slit and you cut using a pair of scissors until you reach the coronal sulcus and you cut all around. طبعا the worst cosmetic result ever. All types will depend upon the retraction and the proper visualization of the coronal sulcus. This is a critical issue. They may bleed a bit. But this is the very first step in all steps. At times there are adhesions. Sometimes there are adhesions. Adhesions between the mucous membrane and the glands. You have to free these things, and you have to make sure that the prepuce or the foreskin is clearly and easily retractile. نسينا عندنا لسه حتة تانية هنقولها الفينيكولايتس. thought that this is the very end, but obviously it's not. بس هنكملها عشان عاوزين نبقى خلصنا.
دكتور
اه
عندي سؤال بس.
قول يا حبيبي. مين اللي بيقول؟
هي أنا محمد يا دكتور.
محمد. قول يا محمد. قول يا حبيبي.
هو الفرينيولا دي موجودة عند إيه بالظبط؟
الإيه؟
الفرينيولا موجودة فين بالظبط؟
You're aware of your tongue, obviously. You're aware of your tongue. The tongue has got an undersurface and the dorsal surface. And on the undersurface أنا بعمل لك analogy بس. بعمل analogy. مش يعني أنا الحمد لله لسه عاقل شوية. The undersurface of the tongue is attached to the floor of the mouth at one point. اسمه الفرينم أو الفرينيولم. فرينم أو فرينيولم. فالanalogy. Look at the penile shaft, at the glands. Dorsal surface is free, but the undersurface in the middle line is attached to the prepuce. Theoretically, you put your how do you call it, RT forceps or mosquito forceps in the space, and you go all around. You will not be able to go underneath. Underneath there is a bit of an attachment. للفرينم أو الفرينيولم. Okay, so I hope. يعني هو محمد أنا I appreciate very much what he's done. He's asked, even if to me things are clear, few things may not be clear, please do not hesitate to ask questions, and please don't hesitate to interact. Well, please do not, يعني I love Noor, I love Pradeep, and I love them all طبعا. ولكن I prioritize things, إنه if all people sort of يا ربي share, it's much better than if only one shares, or two, or three, or four, or five. Please interact as much as you can.
اوكي تمام جدا. كتير يعني.
خلاص عرفتها محمد. عرفتها الفرينوم فين بالظبط؟ في الاندر سيرفيس ميد لاين. اندر سيرفيس في الجلاندز ميد لاين، وفي فرينجولار فيسل. اوكي. Whenever you touch the penile, the prepuce, also you expect a bit of bleeding. ايه اللي احنا بنشوفه ده دلوقتي؟ شفنا بلاستيبال ولا ما شفناش بلاستيبال؟
هو ده يا دكتور البلاستيبال.
ما شفتوش. تمام. You can see how people are usually assistants are holding thighs flexed and abducted for obvious reasons طبعا، يعني مش عاوزة كلام. You may not introduce the anesthetic from the undersurface. This area is more sensitive, and the urethra is somewhere here. I would go from the dorsal surface using one needle. You don't need to percutaneously go through different needle punctures, through one puncture.
Doctor, in case of hypospadias, epispadias, these circumcision are not done, right? They're used.
Not done. If someone is coagulopathic, for sure, or if they're hypospadic or epispadic, they're not done, because the prepucial skin is used for the reconstruction of the urethra. Pradeep is telling us something that is really important, because it's always worth remembering the contraindications before the indications. You don't want to harm people. If people have got hypospadias, any degree of hypospadias, Pradeep was telling us that hypospadias comes in different degrees, or whether it's just glandular, coronal, مش عارف penile, scrotal. We'll discuss this with the peds. We'll consider it part of the peds and discuss it. And remember that it is. انتوا معايا ولا you're gone?
No, we at least.
يا دكتور معاك.
مع حضرتك.
مع حضرتك يا دكتور.
Okay, people specialize in orthopedic surgery. It's 1 in 300 and they specialize in it. They keep performing just like the cleft lip and palate. People specialize in cleft lip and palate surgery. They don't want their palatal closures to reopen, although this is something that they encounter not uncommonly. يلا نكمل البلاسيبال دي.
Doctor, my question was, I mean, this reconstruction should be done in this early age, or it will be performed later?
It won't be done in this early years. No, it won't. It won't. You can wait for hypospadias. It's not a problem.
Okay.
Not a major problem at all. You can wait. You usually wait until people are older. You don't operate upon them in this age group. They haven't got any problems. If they're penis coated, there's a problem maybe of gender problem. Okay.
Okay.
Yalla, how about what's going on? Yalla, where is the placibel? The placibel is there. It's disposable. A suture stud around it, and a lot of times it may be even left to slough alone. I don't think it's very nice to do that. All devices that are supposed to ensure the safety of the glands and to provide men with a better cosmetic results. خلاص, staplers. Pradeep was preparing the stapler thing. خلاص, it will be last issue to remember that complications are very, very important. People may bleed, obviously. People may have their foreskin left behind, part of it. They may have more than foreskin excised. They may have their glands injured. They may have their urethra injured. They may have the penile shaft being embedded in the suprapubic area. يلا نشوف آخر حاجة ولا خلاص؟ يلا عايزين نخلص
هو مفيش حاجة تانية يا دكتور. هو
خلاص.
ما كانش
يبقى
عندي.
بعد كده يلا يبقى كده احنا ممكن الورقة التانية، مش الورقة فيها وش تاني يا حازم؟ الوش التاني بتاع البريبيوس ده ولا هي كده بس؟ هي تيك هوم مسجز كده، دي circumcision، او مش عارف احنا قلنا اهو نشوف all hernias are operated. You're well aware of that. You don't have umbilical hernia in a child is an exception. خلاص, in an infant. Like in general, all hernias are operated. Not all hydrocele are operated. I hope that you appreciate that hydrocele, they're not operated unless they're big. Hydrocele infants are conserved. Varicocele are usually nothing to worry about. The more the dissection, the more the hematoma. قلنا الكلام ده كله. Operating on the scrotum. يلا حازم ممكن، وحازم طبعا عنده سؤال هنا مشهور قوي، بيقول لك what are the scrotal incisions، بيستغرب ليه بالطول. Scrotal incisions are usually transverse ones for obvious, for healing purposes and so on. Operating on the scrotum may well be followed by hematoma. never diagnose hydrocele before transurination. The seal may hide a tumor. A degenerating tumor may feel like hydrocele. Sexually non-active males do not usually develop epididymoorchitis. Having excluded that by age per se torsion, urgent operation per se طبعا يعني alone. A strangulated hernia compresses the cord simulating torsion. A strong
pubonicele, strong pubonicele.
strangulated I guess.
strangulated عشان استغربت. strangulated بالظبط. strangulated pubonicele. This shows you how even the thing that you write mean you're not able to understand at one other stage. Simulates torsion on undescended testis. لو undescended testis وبيونوسيل يبقى طبعا strangulated it will very much simulate this problem. يبقى هنروح بقى لموضوع اخر موضوع هتكلم عليه امبارح. يلا يا نور. متشكر جدا يا براديب. Thank you very much.
Thank you, Doctor.
I think everyone who's asked questions and everyone who's interacted. بس لسه نور هنشوف صورها يعني عشان الصور اللي هي رسماها علشان ايه بس نبقى خلصنا ما يبقاش عندنا اي حاجه مستنينا بكره ان شاء الله we'll start with the peds. We'll get peds done rapidly. We've got 2 weeks to go before the original mid-year vacation.
هو اعتقد يعني انا ما فهمتش حضرتك قصدك ايه بس انا عملت يعني اللي كنت فاهماه من كل صورة.
كويس. ده هايل.
التي بي رسمت اللي هو فيه كولد ابسس.
الصور ملخبطه عندي ما اعرفش ليه. Who's sharing the images؟ الصور يعني
وانا عم شارك دلوقتي باينه.
ايوه كده هايل. يلا التي بي. ايوه قولي عملت ايه في التي بي. برافو عليكي.
التي بي
جدا.
التي بي فوق الالسر اهيت الساينوتيك مارجن والاندرمايند ايدج والنكروتيك فلور
واهم حاجه قدام ولا ورا.
واللي على الابيديدمس ورا اهو فيه الكولد ابسس فاتح ساينس posterior.
You should have shown it. You should have applied this as a undermined already. انا عارفك رسمتها فوق بس you could have already depicted on the diagram. هايل كويس. How about the epididymis? What's happening؟ كملي انت. انا مالي انا. كملي.
والابيديدمس عملت عليه اهو زي كولد ابسس.
موجود فين؟ انهي بارت؟
ورا التستس موجود
ورا التستس. انهي part of the epididymis؟ Which part of the epididymis؟
التيل.
برافو عليكي. What about the vas؟
of epididymis و affects الduct عشان التي بي وكده.
What about the vas؟ What's wrong with the vas؟
beaded vase.
طيب the two missing things that you should add are a nodule or tubercle in the prostate and tubercle in the seminal vesicle. That is all what is missing. You should add these two things because زي ما قلنا امبارح there may be a nodule or a nodule is a tubercle يعني in fact مش كده ولا ايه؟ Tubercles just vary in size. They may be very small, microscopic, but they may be bigger until they become a large thing that you call a tuberculoma. They just add, just like you've done this beautifully. This job you've done beautifully. You just add a nodule in the semivesical nodule in the prostate. How do the nodules, these nodules, how do they feel? قلنا امبارح how do they feel? They've got a special feel كده. What about their feel? Feel this feel like a crag, like a very high, hard, topped, sharp cliff. بيسموه craggy. They call it a craggy feeling. Craggy, whatever this means. يعني I've never felt it. I don't really يعني appreciate what it means except what I'm saying. طبعا ده فرق ان الواحد يبقى عارف حاجه ويقولها ولا عمل حاجه ولا حصلت له الحاجه وبيقولها. فرق بيبقى كبير بينه وبين نفسه على الاقل. maybe not elicited by whoever is hearing, by the audience. فيلا قول لنا بقى التي بي. يلا قول لنا يلا ايه في ايه وايه 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 وايه. الجلد فيه ايه؟
الجلد فيه posterior sinus على
السكوب. sinus. How about the tunica؟ tunica فيها حاجه؟
لا.
والتست فيها حاجه؟
لا.
والابيديدمس؟
الابيديدمس هو التيل بتاعه هو اللي بيبقى
برافو
فيه،
عليك. والفاز
والفاز بيبقى بيدد.
والكورد.
والكورد
The answer may be nothing. The answer may be nothing. الكورد في حاجة غير الفاز، يعني الكورد في حاجة؟
لا.
لا. طب والبروستيت؟
البروستيت ممكن يكون فيها tubercles،
والسيمن فيسيكلز؟
ممكن يبقى فيها برضو tubercle.
How do you describe the feel of these tubercles or these nodules?
كراجي.
تمام. End of the story. هايلة. سوبر. أو شايفها even when you thought because this was just a precaution that you're trying to intimidate me, just telling me I did not understand, but this is what I did. You did it perfectly. يلا السيفلس. طب السيفلس؟
اوكي السيفلس انا عملت اللي هي الالسر بتاعتها اللي فوق اللي هو الواش ليذر فلور والبانشد اوت ايدج.
وبتبقى قدام ولا ورا؟
بتبقى قدام، بتعمل
أهم
anterior ulcer.
حاجة the side. Remember, you start with the side. You always start with the side. The side is the most important thing, but everything. يبقى الجلد فيه anterior ulcer with the characteristics that you mentioned. Yes. About the tunica, is there a hydrocele or no hydrocele?
فيها secondary hydrocele.
How about the testicle?
التستيكلز هي اللي بتبقى mostly affected عشان هي mainly syphilis ده بيأفكت الارتريز، فبيعمل بيعمل fibrosis في التستس اللي هي tertiary syphilis يعني.
تمام. What other characteristic about the syphilitic orchitis other than the gamma and that it's sloughing and it's interior and the secondary hydrocele? Okay. What is lost with the syphilitic orchitis? انت عارفة something is lost.
It's testicular feeling.
بالظبط. This is all about syphilis. طبعا if it's primary syphilis there will be a genital chancre بقى somewhere wherever it is. لكن primary syphilis will not. طبعا primary syphilis affects only the skin and it's genital, extragenital with the lymphadenopathy, and it's painless and it's very indurated. It just feels like the feeling of your button. The button, you keep palpating your shirt or your whatever, and suddenly you feel a very indurated part that is the button. They liken it to that. خلاص syphilis خلاص. يلا هنروح بقى للاثنين التانيين. يبقى مرة تانية the skin syphilis. What is the skin syphilis?
في anterior ulcer.
DD of an ulcer of the scrotum. The DD of an ulcer of the scrotum.
ممكن.
انت لسه قالتني؟
التي بي والسيفيلس.
ادي اثنين. طب وايه كمان؟ Just like the skin anywhere, just like the skin, a malignancy of the skin anywhere.
Ulcer.
A malignancy. What malignancy does the skin develop anywhere in the whole body?
Squamous cell carcinoma.
SCC. Absolutely. SCC بالضبط. Squamous cell carcinoma. Chimney sweeps. When chimney sweeps operated, because there are no chimney sweeps obviously at the moment, but when chimney sweeps used to clean the chimneys, wherever there are chimneys in which countries, the soot usually affected the scrotum and they developed squamous cell carcinomas. It was an occupational disease. يعني ايه occupational disease؟
يعني disease بيجي في الworkers عشان risk factor معين في their job، زي مثلا pneumoconiosis وكده بيجوا لل.
And accordingly what happens? And accordingly what happens when it's occupational? What do they deserve? What do they qualify for?
Regular screening.
Okay. Screening, okay. And then what do they qualify for?
Compensation. Medical.
بالظبط كده. يعني there's a list. There's more to medicine than clinical medicine. في occupational medicine. There is more to medicine than clinical medicine, believe me. واحنا because we get very much absorbed in clinical medicine, we think it's the only discipline of medicine. It's not. There is occupational medicine where it's becoming very important because people who have lost their lives or given their lives to this pandemic are considered occupational diseases. دلوقتي occupational medicine becomes ever so important. But it means that there's a list of occupational diseases, and if it's proven that this professional or practitioner has suffered this disease from his occupation or occupation, طبعا في حاجات واضحة، حاجات تانية مش واضحة، he deserves a compensation and whatever بقى a pension and so on. اوكي يبقى طب في حاجه تانية بتيجي في البق وفي في الاريا كمان تاثر على
لا ulcers
اورال السرز وجينيتال السرز. ايه مين انهي زي اللي بيجيبهم دول؟
كان اسمها ايه؟
باسل ديزيز.
باسيتس
بس بالظبط كده. Remember that ulcers of the area, you can be ulcer button ulcer, the DD of an ulcer anywhere in the body, starting with the scalp, the face, the tongue. طبعا put aside the GI لان طبعا arterial ulcers, gastric ulcers, renal ulcers, I don't know, rectal ulcers. ده سيبكم من دول لان طبعا these are very very important. But the skin ones are very important. Skin ulcers of the face, ulcers of the scalp. طبعا most famous انهي اكتر لوكيشن بيجي فيه ulcers يا شريره يا نور؟ انهي اكتر مكان بيجي فيه ulcers skin wise؟ شفت منهم كتير يمكن كمان.
في اللور ليم.
The lower limbs, absolutely. An ulcer of the lower limb or the foot بقى طبعا this may be the commonest. Ulcers of the leg and the lower limb. I mean the leg and the foot. Scrotal ulcers, skin ulcers anywhere, face ulcers, scalp ulcers, tongue ulcers بقى. Putting aside طبعا كل الجي اي تي. الجي اي تي ulcer ده حكايته لوحدها طبعا. herpes مش عارف بقى ulcers of the scrotum. طب يلا يبقى السيفلس هايل. يلا بالهارزيزز بقى. يلا قلنا how about بالهارزيزز؟
بالهارزيزز بتأفكت mainly الفينز، فهتبقى mainly affecting الكورد. بيبقى الكورد thickened بس not matted in comparison مع الفلاريزز اللي بيبقى
What is matted? What is matted? I don't know. What is this word, strange word that you're using?
matted يعني not matted يعني أنا أقدر أحس الفاز alone، إنما matted لما الكورد لما أجي أحس الفاز فيه.
ودي الوحيدة اللي بتعمل كده مين؟
الفلاريز.
الفلاريزز بالظبط. If you cannot feel the vase as a separate structure, which we do during what we call the scrotal neck test, where you put your thumb in front and your index in front, قصدي behind, and you roll the structures. You hold the structures towards, well, you identify the neck of the scrotum, obviously, but then you pull the structures, all the structures towards the lateral side, and you keep leaving them to the medial, towards the medial. Then you feel the vase as a separate structure that is firm and that is rope-like or string-like. تمام. يبقى بالهارزيزز تعمل بتبقى انتراسكروتال ولا بتطلع لفوق؟
لا بتطلع لفوق، تبقى في الكورد كله صح؟
تفتكري في الكورد؟ والبالهارزيز عاوزه بلكسس ولا عاوزه مين فينز؟
تبقى في اللور بارت
بالظبط. بتبقى انتراسكروتال. strictly intrascrotal. وبتبقى هي ايه الماسز اللي بالهارزيز دي بتعملها؟ what are they formed of? what are these بالهارز الماسز يعني؟
اوفا
يعني بالهارزل granation tissue زي tubercles granation tissue that you call a tubercle. At times you call them بالهارز pseudo tubercles by the way. At times you call them pseudo tubercles because again they're masses of different size. They can be granular, they can be nodular, they can be massive. ممكن يبقوا a granule is very small, a nodule is bigger, and obviously a mass is much bigger, where like you beautifully described, the intrascrotal cord is thickened, maybe the head of the epididymis also, but the vase remains separate. At times there are multiple nodules, one on top of the other. بيسموهم ايه لما تبقى nodule on top of the other؟ تفتكري زي ايه الواحد بيسبح بيها دي؟ الواحد بيسبح بيها ايه؟
بيدد مثلا.
بتبقى روزري، بيسموها بالهارز الروزري. روزري. اوكي. فساعات البلهارزيز يأفكت الجلد كمان، يعمل سودو اليفانتيزز. و there may be also a nodule of the seminal vesicle prostate because it causes a pericystitis, a periprostatitis and so on. الفيلاريا بس واحده. كنت هتقولي ايه؟
ممكن في اليورينري بلادر برضو يبقى فيه اللي هو ساندي باتشز وكده.
طبعا.
بيبقى فيه برضو ساندي.
Okay, الفيلاريا the last thing that we're going to discuss. فيلاريا. How about فيلاريا؟
It affect mainly lymphatics. فبتعمل الكورد يبقى برضو thickened وبيبقى matted، ما بقدرش احس الفاز في السكروتال نيك تيست، وبيبقى فيها masses كده في firm to hard masses في الكورد، وبيبقى فيها
تطلع لفوق توصل لفوق ولا توصل لغايه جوه ولا لا؟
ما ده lymphatic
عشان الليمفاتكس بالظبط كده بتعمل lymphangitis perilymphangitis and it causes the vase not to be felt separately and the cord mass extends into all the way up to the retroperitoneum because the lymph node lymphatics everywhere. بالظبط. How about the hydrocele? It's the hydrocele.
secondary hydrocele هما كلهم فيهم ما عدا التي بي هو اللي ما فيهوش hydrocele.
تمام. والسكندري hydrocele ده قصدي the cord thickening and because everything is matted ساعات يقولوا عليه the pipe stem يقولوا عليه pipe stem يسموه pipe stem يقولوا في الفيلاريزز what we call the pipe stem this massive large of the cord with the vase not felt as a separate structure. السكين ممكن بيكون فيه ليمفيديما وبكده يبقى احنا خدنا النهارده كان دكتور هاشم فؤاد رحمه الله عليه اللي هو كان عميد الكليه في وقت من الاوقات وكان very popular and very I don't know what else. لا كان له ميزات كتيره جدا طبعا ولكن كان دايما بيقول let's push the point of our tiredness a bit beyond our limits او let us push our limits. فده اللي احنا عملناه دلوقتي. احنا ابتدينا مش عارف الساعه كام وادينا بشويه قعدنا نتاخر طبعا خدت راحنا في الوسط تكنيكال كده بروبلم لكن thank you very much. I thank Pradeep and I thank Noor and I thank
thank you
Hazim and I thank you all.
Doctor, I have a question لو حضرتك مش مستعجل.
لا مش مستعجل. مين اللي بيقول؟
شيرين.
يقولوا شيرين. قولي يا شيرين.
هو في ال UDT is a contraindication للcircumcision.
ايه؟
UDT undescended testis.
I don't see why. Why is the UDT? I don't see why.
هو we were once في الماينر والدكتور قال إن هو he's not gonna proceed علشان في UDT that's why I'm wondering دلوقتي.
Not the complications. The frank complications are hypospadias. The only worry about the UDT is to tell the parents at the same time and make them see that there's no testicle, just in case he's brain. It's important that people see what's going on. If there's no UDT, you do not only write about that or you not comment on it. You get the parents and make them see what's going on. There is no UDT.
Medical legal يعني.
Medical legal أكتر من هنا أي حاجة.
Okay. ماشي. Okay. Say.
One other aspect of medicine is medical legal. يعني this is another forensic medicine and legal medicine is again very very important. It's not all clinical medicine. فأنت بتتكلمي في نقطة مهمة جدا جدا.
Thank you, doctor. Say.
As an undergrad, as a more junior doctor, I did not care about legal issues. I did not care about occupational issues. I didn't care except about clinical medicine. I did not care about public health. كنت فاكر ان كله انا clinician وخلاص. طبعا my views have changed and I've evolved completely to appreciate all other disciplines يعني. خلاص شكرا يا شيرين وهشوفكم بقى بكره الساعه 9 برضه ان شاء الله ويوم الثلاث اجازه and so forth. Okay.
Thank you doctor. Thank you.
Thank you all. شكرا يا نور وشكرا يا حازم.
شكرا يا دكتور.
شكرا نهال.
شكرا يا دكتور جدا.
شكرا يا جماعه. شكرا.